Okay, so today we're going to be talking about the cryotherapy machine. It lives in PR4 against the wall. It is most often used by Dr. Payton for some of her eye cases. So anytime you see cryopexy, possible cryopexy, you will most likely be pulling out this machine. So the first thing you want to do is find the power cord and plug it in. So you have some power. The next thing that you're going to want to do is turn on the gas, which is obviously located on the machine here. It should have a wrench hanging off the side here. And just remember, lefty-loosey, righty-tighty. And you'll hear that little sound. That means gas is flowing through. If you ever run out or it's showing empty, more of these canisters are in the decanting room located beside Lisa's office. Next thing we want to do is turn the machine on. The power switch is on the right side, located here. So we'll just switch that on. You'll see the digital display go on, and you'll notice in the corner it is giving you a digital reading of how full the gas tank is. So it looks like it's full and it's good to go. So the next piece that we need to do is plug in the hand pieces. Okay, so there are two different hand pieces that can be used with the cryo machine. We have two of each, so a total of 4, and they all live in the furthest Pegasus cart in PR4. The first one that we're going to look at is the standard 2.5 curved. This is the most popular option and used most of the time. So we'll just open that up and have a look. And it's important to note that most of the time this is used, it's going to be for a clean procedure, but there will be the odd instance where you'll have to use it sterilely. So these are sent up to MDRD to be sterilized. You'll notice 2 ends, one with a cover and one without one. This is the end that will plug into the machine, and this is the end that will be applied to the eye. So just get a good look at it. This is the standard curved. The other tip that could be used is called the mid-reach hammerhead. It isn't used as often, but the surgeon might ask for it, so just confirm in huddle which one they want. So we'll open that up. So again, you'll see an end with a cover. This is the part that gets plugged into the machine. So make sure the tip is removed before you put it into the machine. And this is the end that will be applied to the eye. Notice it's a bit longer and a bit more bulbous. Okay. Okay, so we've gone over both of the hand pieces. We'll now talk about how to plug the hand piece into the machine. So you'll notice usually on top, this is where we store the foot pedal. This is how they'll activate the cold release when you're ready to go. So you just want to make some room for you. So you can put this down on the floor, as close to where their feet will be, or put it somewhere safe before you're ready to get into position. So very important never to touch this tip while it's priming. This is the end that goes into the machine, and it's just a full push straight in until you hear a click. When you hear that click, you can look at your digital display, and you'll see that the type of probe you've plugged in is now displayed digitally. That means it's ready to go. We'll then press this button here to prime the probe. And this process takes a while. It takes a full 90 seconds to fully prime. It's also important when you're priming that you don't let the tip touch anything else other than its container or maybe a sterile basin to give you some more room to work, because as it's priming, it might be hard to see in the video, but it'll start frosting over. Okay, so the cryo machine's gone through its priming cycle. You'll know it's complete. You'll hear 3 distinct beeps, and then this display will show up almost as a timer. What this tracks is when the foot pedal is pressed and the cold is activated, it'll time how long the cold is being applied. So here we have the foot pedal out right now, which we'll show here. Okay, and when my foot goes down on it, it will pretty much trigger the cold to be released from the cryo probe. So I'm going to put my foot down here and hopefully I can get it to show in the video. There. Okay, and then when you hold down the foot pedal, you can kind of see a little bit of frost forming around the tip. And then when we release it, you'll kind of see it fade away quickly. And then if we look at our digital display here, you can see that I was holding the foot pedal down for about 15 seconds. So they don't always keep track of this, but there might be the odd occasion where they'll want to track how long they applied cold to the eye. So just ask before you use if you want, if the surgeon wants it documented how long they're applying the cold for. Okay, so now we've shown how to set up the machine, how it's applied, how you can keep track of the cold application. Next thing we're going to go over is how to shut off the machine. So the first thing I would suggest doing is turning off the gas, because that tends to be forgotten about, and if the gas is left on while the machine is off, we could run out, so then the next time it's used you have to go running for a tank. So we're going to turn off the gas first, and it's going to be a righty-tighty to turn it off. Okay, so tighten that, that's off. Next thing we're going to do is we can go back to our off switch, which is on the right side, and we can turn that off. It is powered down. The trickiest thing for putting the machine away is just getting the handpiece out. It's not a straight pull, do not pull on it. If you look here, you'll see a little black button behind. What it's going to be is you're going to tilt it forward, and then you're going to push this black button in, and that will unlock the handpiece. Okay. Now, if you're ever wondering about this cord, this basically is where the gas gets fed off once it's been released. You can keep it just hanging here if you want, or if you want, you can splay it across the room. It's up to you. Okay, that completes the setup video for the cryo machine.